Hello, mighty family. Welcome back to another Dr. Eric Debunks. Ever have that nagging joint pain that just won't go away? Ever been told that you have arthritis but not really know exactly what is going on? Today, we're going to break down what it means to have osteoarthritis, how to potentially prevent it, and of course, how we can treat it. So, what does it mean to have osteoarthritis and how do you know? So, from an anatomic standpoint, having osteoarthritis means you're experiencing changes in your joint tissue, particularly structural alterations of your cartilage and bone. Changes can also occur on the surrounding ligaments, the joint capsule, and muscles. So then, how can we know for sure? It is possible that you may experience some of these structural changes but not actually have symptoms from it. However, when you do have symptoms, it's typically manifested by pain when moving the joint and tenderness along the joint line. So for your knees, you'll typically feel pain when pressing on that joint line to the right and left of your kneecap. I know what you may be thinking next. What type of imaging studies do I need then? So this is one disconnect I see between patients and their providers, is that so many patients request for an MRI, which is rarely necessary and often extremely expensive. If your providers are likely certain that your symptoms are from osteoarthritis, a simple x-ray is enough for confirmation. So in a knee x-ray, we can see bony changes or even the joint space narrowing, meaning there's less cushion between your joints. So here is a picture of a normal knee x-ray. And I just want you to focus on the joint space between the two big bones. Now I want you to compare it to this one right here. Notice how the joint space is drastically different. And you even see what you commonly hear, bone on bone. I know we all know friends and family that suffer from osteoarthritis. So for those that are lucky to not have it, you must be wondering, how can we prevent it? Research studies have shown that the biggest risk factor for the development of osteoarthritis are high-impact sports and traumatic joint injuries. Following up those would be being overweight or obese. Some of these things are hard to control, especially for those that were athletes partaking in a high-impact sport. What we must focus on now is what we can control, such as strengthening the muscles surrounding our joints to decrease the risk of traumatic joint injuries. Currently, there is no direct evidence showing that by preventing obesity, we can prevent osteoarthritis. However, we do know that being obese does increase your risk for osteoarthritis and symptoms from it. So then, what are the best treatments for pain for osteoarthritis? I want to break this down into three parts. That's lifestyle, medications, and procedures. Many studies have shown for those that are overweight or obese, losing just 5% of your body weight can lead to substantial relief. In addition, physical therapy with a focus on strengthening the muscles surrounding your affected joints can help with pain relief. The idea here is that the stronger the surrounding muscles are, the more pressure it can take off your joint. In terms of medications, I tend to stay away from the narcotics as there is no long-term benefit. Instead, I reach for the Tylenol, the ibuprofen, which are both much safer. Of them all, Tylenol is the most safe in older adults, so I will lean into that as prolonged ibuprofen can be harmful. But a multimodal approach is the best, meaning don't underestimate the efficacy of adding a heating pad or an ice pack to your pain regimen. Lastly, there are now more and more different types of injections for pain relief in patients with osteoarthritis. There are injections of platelet-rich plasma, stem cells, hyaluronic acid, and of course steroids. There is still ongoing studies as to which type of injections are superior. The one injection I want to take a moment to debunk are the steroid injections. So the question here is, are steroid injections bad for me? And do they further damage my cartilage? So in 2017, there was a study done by Tufts University in Boston that randomized 140 patients, half to getting steroid injections every 3 months and half to getting saline injections every 3 months as a placebo. They followed these patients over a span of 2 years and found greater volume loss of cartilage in those with steroid injections and really no major differences in pain control compared to placebo. However, I do want to mention that there are some limitations in this study and a few things to consider in these conclusions. One, it's hard to determine if that change in cartilage volume was actually significant to actually cause more symptoms. Two, the study did not follow patients on pain relief shortly after injections. As we know, most pain relief comes after a week or so after the injections. So I have done numerous steroid injections on patients with knee arthritis. Some experience pain relief for over 6 months to a year. Some experience no pain relief at all. So all to say, it really comes down to you and how you respond. If you're in a ton of pain, I certainly still think it's worth giving a try. And if it's effective, then getting a periodic injection will not cause harm. However, if you're not experiencing any pain relief, then it's probably not worth the potential cartilage loss. All right, Mighty Family, this wraps up our segment for today, and I hope you learned a little bit more about osteoarthritis. We created Mighty Health with the understanding that many people suffer from joint problems. So we built a workout library that is filled with joint-friendly exercises. So don't hesitate to check those out and start building back up that strength. As always, I look forward to connecting with you all again soon. For those that are not a part of the Mighty Family just yet, check us out at mightyhealth.com for more. We're striving every day to be the modern, holistic home for healthy aging.